So you go to the gym after work at 5 o'clock and you get on the elliptical machine for 30 minutes and you get on, and you get off and you go home. And it's done primarily for the purpose of improving fitness. It's great, we want people to exercise, but while we know that physical activity rates have declined in this country and others, sport and exercise rates have remained the same. They've really stayed consistent. So what we're seeing that's contributing to a lot of this obesity is this decline in physical activity, things that are attributed to changes in our activities of daily living. Where we used to be more likely to walk to school or walk to work, we now drive. Technology has replaced a lot of the things that we used to have to do manually. So those types of things. So that's really where we can have an impact. Obviously, fewer people are working in high-activity manual labor occupations. I'm sure a lot of you are like me, where you go to the office, you sit in front of 2 screens for 8 to 9 hours, and you go home. We know that a lot of people are not taking public transit, and of course, an increase in automobile use, a significant decrease in children walking to and from school, and along with this decline in just general physical activity, we've seen an increase in sedentary activity where people are really just sitting or just laying down and not doing much of anything else. I highlighted the 2 in the middle because, let me try this. Happy to show you this. Oh, here we go, look at this. So I highlighted those 2 because I think that's where we can have the most impact. That's where the biggest opportunity for us is. So we're obviously doing less of the walking and active living and more of the sitting in traffic and the driving. We're at the very end of this physical activity evolution scale, although that computer looks pretty old, so maybe there's another picture we need to add to it. But we know how important walkable and bikeable communities are for health. Studies have found a statistically significant connection between walkability and health in communities. And that connection is even stronger in neighborhoods with the highest concentration of minorities and lowest socioeconomic status. So where the need is greatest, we can actually have a bigger impact. Areas with more amenities for walking and biking are associated with more active commuting to school. And we know that walking and cycling can be increased through community scale, urban design, and land use policies. And while the health benefits are really important to us at the health district, we know that there are other really significant benefits, including economic development, social connectedness, public transit, and stronger and just more vibrant communities. Walkability has been found to be statistically significant in predicting neighborhood housing values and has a significant and negatively correlated relationship with foreclosures. So when they control for other variables, they find that more walkable neighborhoods are typically have higher property values and fewer foreclosures. So whenever we do anything, and I know you guys are all experts in this as well, we need to think about the difference between equality and equity. Equality is, I'm going to give everybody in this room 2 jelly beans, and it doesn't matter if you don't like jelly beans or you don't like green or you need more too. I'm just going to give everybody the same. Equity is taking into consideration the needs of specific communities, the needs of specific populations, and that's how we can really move the needle on health outcomes. I think we can all agree that walking, biking, and public transit should be safe and convenient for everyone. But we can probably also all agree that we're not quite there yet. In fact, walking and biking is often more dangerous and facilities are less available in low-income and under-resourced in communities of color. And while low-income people may be walking and biking more, they're often doing so in more dangerous conditions, and many times because that's their only mode of transportation. And when you look just at kids, we know that communities of color and lower incomes have higher rates of obesity, but they also have differences in just access to places to be active for kids. So 70% of African American neighborhoods and 81% of Hispanic neighborhoods lack recreational facilities. African American neighborhoods are 38 times more likely to have sidewalks in poor shape, and we know that there's more dangerous driving conditions as well. These are national statistics. I think maybe some of the issues are relevant here in our community, but I just want to point out that they're national statistics. High-income neighborhoods are 90% of them have sidewalks, 75% have streets with lighting, and they're 3 times more likely to have traffic calming features in those neighborhoods. Whereas lower-income neighborhoods, less than half have sidewalks, about half, only half have lighting, and we know that there's typically more speed, more high speed and more high traffic roads. Which of course, if the conditions aren't ideal, you're going to have issues with safety. We know that the Latino pedestrian fatality rate is 60% higher than it is for whites. The African American fatality rate is 75% higher. African Americans comprise about 12% of the population, but they account for about 20% of the pedestrian deaths nationwide. So we know that there's a great disparity there. Age is always a factor, but with respect to older Latino adults, they have a pedestrian fatality rate that's 173% higher than for older white adults. And low-income people are almost 2 times as likely to be killed while walking than are people of higher income. And all of these things, you know, if being active in your community isn't really accessible, it's not safe, it's not attractive, then you're probably not going to be active unless you absolutely have to, and that really contributes to the health disparities that we see. We know that obesity levels are highest in low-income and Latino and African American populations. This statistic really impacts me every time I see it, but over half of Latina girls and almost half of African American girls are expected to get diabetes over the course of their lifetime. So right now, with the trajectory that we know, you could go into an elementary school classroom and you can look at the girls in there, and of the African American and the Latino girls, you can just say, unless things change, half of you will have diabetes. I think that's unacceptable. And we know that people in low-income communities have lower activity levels and higher BMIs. So of course there's a challenge for us. We know that populations that depend more on walking and biking are often at greatest risk for poorer health outcomes and safety. We know that sensitivity and creativity are often needed to ensure that we get input from those priority populations. And that getting input from those priority populations are so important because we never want people to feel like we're doing something to them. We want them to feel part of the solution. And so by doing that, we can not only ensure that the transportation system supports biking and walking, but it also is serving the needs of the community. So I will turn it over to Kathy to kind of talk about this plan and how we're trying to do that. Thanks.
So in order to address the challenges that Nicole talked about that really represent underserved communities, we need to look at both the process of developing the plan and the outcome. And this is for the FHWA. For the outcome to be equitable, the process to get there should also be equitable and based on principles of transparency, inclusiveness, respectfulness, and building trust in the community. So this is just kind of a range of people who bike. So who are we planning for? We're planning for people who walk and bike, people of all ages, from the young kid in training wheels to the spandex road warrior, and all the people in between who are biking for recreation, for fun, or because they need to bike to get to work. And there are a lot of health benefits, as Nicole mentioned, to active living. And people are walking for all different reasons. For fun, to get to school is a great one, builds independence and responsibility for children, and then the connections to transit. Every transit trip begins and ends with a pedestrian trip. And access to transit, walking and biking to transit can really, biking can expand the catchment area. So if maybe a 10-minute walk to a transit stop is feasible, but you're 15 or 20 minutes walk away, taking that on bike makes it a shorter trip and you're more likely to take that trip. So the Regional Bicycle and Pedestrian Plan is an update to the 2008 plan. We're looking at not only the network, lines on the map, facility types, but also policies and programs to comprehensively support walking and biking in the valley. And I want to talk today a lot about our public engagement strategy, which is kind of our main way of including people in the process and trying to reach underserved communities. We have a variety of methods that we have incorporated into our public outreach strategy. We've offered opportunities to comment at multiple points within the plan and provided a lot of information online. So this is about an 18-month-long project to update this plan. We kicked off in October of 2015. We're working with a stakeholder advisory group. We have several milestone meetings with those groups throughout the year, but have been meeting with them monthly for updates at their standing meetings. We had a number of pop-up meetings between November and February. And what I mean by pop-up is rather than asking folks to come to a meeting at the RTC or community center at a time we designate on a weeknight, we looked at events in the community where we could go out to where people would already be and build awareness about the plan and try to receive feedback there. So we attended 12 different meetings, 12 different events, and I'll tell you more about those. And then we're in our second phase of outreach right now, and we attended 2 big events recently. So we hope to be wrapping up the project in March of 2017. So this kind of outlines our decision-making structure for participation. We have, of course, our project management team, the general public. These are our 4 stakeholder advisory committees, the Regional Open Space and Trails Work Group of the Southern Nevada Regional Planning Coalition, the Southern Nevada Pedestrian Safety and Legislation Task Force, the Southern Nevada Bicycle Coalition, and the City of Henderson Bicycle Advisory Committee. So we are also working through the RTC Executive Advisory Committee, the Metropolitan Planning Subcommittee, and then ultimately the RTC Board will approve the plan. So this is kind of the general structure, and equity shows up in a couple places. First and foremost with the project management team. Working with Alta and CH2M, we've come up with a public engagement strategy where we've tried to really include a range of different people in the valley. And so making a conscious effort to do that is the first step. And then getting those people to participate. And then we're kind of relying on these stakeholder advisory groups as well to also be considering the needs of those underserved populations. So we have some digital ways that people can participate. The first is we've developed an email list where we can email updates to people who choose to receive updates. And we've collected email addresses at a number of pop-up meetings as well as different events. We had an online survey that we pushed out by email, but we also brought iPads to events. So if we went to a swap meet, we had 4 iPads there where folks could go ahead and take a survey right there. We also had an online mapping tool where people could mark places they'd like to go to, where there are issues, draw lines on the map to show connections they'd like to make by bike. Project webpage with information. So this is an equity map that we developed at the beginning of the project. And we looked at factors such as age, folks that are under 18 or over 64, households that don't have access, daily access to a vehicle, populations of color, and those lower income residents. And so the darker areas show those underserved areas that we wanted to target for participation. So this map shows those underserved areas in the crosshatched area. So you can see we've kind of just transferred that in the crosshatched area. And you can see the orange dots on the map are the locations of our outreach pop-up events. So we went to Get Outdoors Nevada Day, swap meets, stroll and rolls, farmers markets. We did one pop-up at the Centennial Hills Transit Center. We went to CSN Campus Connect. And you can see in the red, the darker areas are showing the survey responses we received, and the lighter shaded areas are showing fewer survey respondents. So while we tried to locate our pop-up events in underserved areas, you can see we're still getting a lot of feedback from people in Henderson area, kind of on the outskirts here. So we made an effort to get survey responses, but we kind of look at this as that it's a self-selected survey, so it's not statistically significant, but people who are interested in biking are those that are going to be most likely to respond. And there are a lot of recreational cyclists in Henderson. There are already a lot of bike facilities there, so naturally there would be a lot of bicyclists who respond in that area. Here are just some photos from our pop-up meetings. This is one of the swap meets out at the farmer's market. So we popped up a tent with some information about the plan and had iPads available for surveys. This is at the CSN event. We also went to the Southern Nevada Health District's Immunization Event. They do this the Saturday before school starts, where families can come and get free immunizations for their children. It's a requirement to be immunized to go to school, so a lot of lower income people came in and we were able to give out helmets and get people on our email list and talk to them a little bit more about their vision for walking and biking. So I just want to go through quickly some of the highlights from the survey we did at the beginning of the project. We had over 1,000 responses. About nearly 30% of those responses were from pop-up meetings, so we did get a lot of responses when we went out into the community. In our mapping activity, we had nearly 700 comments on the map, which really helped us to develop the proposed network map. Here's some kind of demographics. Income level, we didn't have a whole lot of low-income folks. Under 25,000, we only had like 17% of our respondents. So we could have done better there. For age, most people were between 35 and 54 years old. From the respondents, most people said that they walk or bike at least once a week to go somewhere or just for fun. We had kind of a spread of different types of riders. We actually got 10% of our respondents don't ride a bike at all, so it was good to have that feedback to understand why people may not be walking or biking, what their issue was that might prevent them from walking or biking. And then we had about 30% in the other categories, people who are not comfortable riding in traffic to those who are most comfortable riding in traffic. So the most common responses for walking and biking were for fun and for exercise, followed by air quality, and then less significantly for commuting. And the three obstacles or concerns that prevent people from walking or biking, first and foremost, was safety. Second was weather. And third was it's not convenient, like it takes too long or they have too much to carry on their trip. 3 improvements that would encourage people to walk or bike more. Better facilities, wider separated sidewalks and bike lanes. And the second was more regional paved trails. And the third, which is the big opportunity, is more safe routes to school, sidewalks, crosswalks, and better signage. So in order to create a vision and goals for the project, we considered a lot of feedback. We looked at Southern Nevada Strong, which had over 70,000 participants. We talked to our advisory groups and received input from them. We looked at the public input from the survey at our outreach events. And we looked at the good planning work that had been done in previous studies. And the vision for the plan, as it stands now, is Southern Nevada will develop a safe, connected, and convenient walking and biking system that serves as a viable transportation and recreation asset. And there are 4 goals. The first of which is comfort and safety. The second is to provide access. The third is health and equity. And the fourth is education and encouragement. So looking at the health and equity goal, It's to recognize the transportation system's impact on air quality and community health while providing ladders of opportunity to underserved neighborhoods. And when we look at socioeconomic mobility, it's the ability of people to move out of poverty, and transportation plays a big role in that. We've seen that underserved communities experience longer commute times. There's a lack of nearby jobs or access to transit, or there's a high cost or time commitment that person incurs in their trip. So low-income households that are located in suburban car-oriented or not served well by transit, not bike-friendly, this is an issue of burden. And some spend nearly 30% of their income on transportation alone. So walking and biking are really an opportunity to really address that issue and challenge. So when we look at the health and equity objectives of the plan, they are to invest in biking and walking in those underserved areas, improve air quality and community health by increasing the number of people walking and biking, and to improve access to destinations like parks, open space, recreation centers, healthcare, education, jobs. So looking at the planning process, we really tried to reach out to and engage underserved communities in the planning process. And we also, as part of not only including health and equity as a goal, but also looking at prioritization criteria. So when we look at the actual segments being proposed on the ground, those new separated bike lanes or on-street bike lanes or trails that we're recommending, there is a prioritization criteria that will give those projects more points if they're in a low-income or underserved area. We did a network planning exercise with local jurisdictions and our stakeholder advisory groups, where we referenced all the completed plans, put all the lines on the map that had ever been proposed, and we worked with local jurisdictions to kind of flush it out. Considered also some of the public feedback that we heard, if there was a high demand for a particular route, and we focused on those high equity need areas. This is a photo from our June workshop. We split out into jurisdictions and kind of looked at the map. We also looked at prioritization criteria, policies, and programs. I'll show you some more about the network map in just a second. But one of the other exercises that we did, safety and comfort are one of our 4 goals. And looking at comfort level, we're thinking about how it feels to be out on a bike in southern Nevada, getting from one place to another. And this chart kind of shows that if you're in a stressful environment, if you're riding let's say on Maryland Parkway on your bike, it's going to feel like a mile is actually 3 miles because you're riding with traffic. It is just a less comfortable ride. So you can see that in the red line here. And then if you're on an off-street trail, like let's say on the Pittman Wash Trail in Henderson, you might feel like that mile distance is shorter. So what we did for the plan, for existing conditions, we looked at the comfort level of all the roadways in the valley. And we categorized them by 4 levels. The first level being really comfortable for a family with young kids. The second for someone who rides a bike occasionally. The third for someone who's a more confident cyclist, and the 4 for a cyclist who would ride anywhere. And this is based on the Medina Institute standard level of bicycling stress. So it looks at what is the street width, the number of lanes, the volumes and speeds, to assign a category to each roadway. And what you can see here is there's actually a lot of green on the map. And what that is showing is that within our walled subdivisions, it's really relatively comfortable to ride your bike. The problem is when you get out of your neighborhood and try to go to a destination, there's not that connectivity. So you're likely going to have to get on one of those red routes, which could be a major arterial with high-speed traffic, no bike facility, wide lanes, lots of cars. So if you're just trying to ride around your neighborhood recreationally, you have an easy, comfortable ride you can do with your family. But if you want to get a couple miles away to your favorite restaurant, it may be a more stressful trip. So when we looked at the network planning exercise, we tried to take into consideration comfort and how we could increase the comfort level across the region for more regional routes to provide better connectivity and a consistent high comfort trip. So this is the draft network, and I don't guess that you can see all the details in this map necessarily, but what you can see is the yellow lines are identifying, the yellow highlighted routes are identifying what we're calling regionally significant routes, and then where you see the red dashed lines, those are the proposed separated bike facilities. These would be the highest level of comfort, and so we're identifying roadways here where we can provide higher comfort and better connectivity across the region. And then if we zoom into where those high equity need areas are, you can see that we're providing a significant increase in density. The solid lines on this map are what is existing, and the dashed are what's proposed. So we're proposing a lot of new routes within this area. This is our prioritization criteria, and you can see we have categories of comfort and safety, where we're looking at, is this an area where there have been pedestrian or bicycle crashes, or does this facility provide a high comfort experience? Access, is there access to transit? Does this address a major gap in the regional network? Equity and health, does this serve an area with a high equity need? Or address populations where there are health issues. And Southern Nevada Health District has a great dashboard with a lot of data on locating where there are disparities and health issues. Regional significance is another criteria, where you're connecting multiple jurisdictions with a facility, or you're connecting to a bike share station, or additional points for consistency with local plans. So, and then feasibility is there public support, potential for near-term implementation? Is there a roadway project like a mill and overlay where it's pretty easy to go in and restripe for a bike lane? So that could be more efficient in implementation. And then quick wins. So if it's a modest investment that you can put in quickly, you get additional points for that. So this is the prioritization criteria we have. And of course, equity and health is a part of that. It helps infrastructure projects score higher. And then we have policies and programs to comprehensively support improvements in the infrastructure itself. So we're looking at things like, these are just a few examples of many. Request a rack program to increase bike parking at destinations where people can request a bike rack be installed. Connectivity retrofit plans, looking at ways where we can improve connectivity, safety and maintenance education activities, bike co-ops or earn a bike programs where you can go work on a bike, put one together, and take it home. Helmet giveaways, NDOT has been awesome. They do a lot of, provide the helmets to us to give out at a lot of events. And bicycle and pedestrian coordinator program, we're looking at how we can build capacity at the local level and that focus on biking and walking, and how we may be able to fund full-time bicycle and pedestrian coordinator positions with local jurisdictions. And then safe routes to school expansion. I know City of Las Vegas does school block audits. CCSD has a great safe routes to school program. So just looking at continued support and expansion of those programs. We also have a number of measures to let us know how we're doing in reaching our goals. And these are just a few examples. We want to look at the miles of walking and biking infrastructure, the percentage of the regional network that's been implemented, the percentage of high comfort facilities. We believe that by increasing the comfort level of bike infrastructure in the valley, we can get the biggest bang for our buck and increase in ridership. Those folks who maybe have a bike in their garage but only ride a couple times a month, if they feel safe and comfortable on on their trip may be more likely to take more trips by bike. So we're continuing to do outreach. We're in our second phase of outreach, which runs through November 15th. We did 2 pop-up meetings. The first was September 17th. We went to the 3 Feet for PICH event. We talked to like 150 people, which is great. Got a lot of good feedback on our draft map. And then just last Saturday, we were out at Get Outdoors Nevada Day again. Talked to nearly 300 people there, and a lot of Spanish-speaking families, which was great. We have an online activity, mapping activity, where we're requesting feedback on the proposed network map, and also on the proposed policies, programs, design guidelines, and metrics. And we are looking at running bus ads in the ceiling of buses to build awareness about the plan, and we've targeted 10 bus routes through underserved areas to promote the plan. We'll also have postcards at Southern Nevada Health District locations and bike shops. We'll do an email blast through Club Ride, and Club Ride is really focused on major employers, so a lot of participants in Club Ride work for a lot of the major casinos, so hopefully we'll reach some more lower income residents through that. And then we are working, have almost finalized a partnership with La Bonita Grocery Store to do a promotional event in their stores. So this is from 3 Feet for PICH. We had a booth up right here, and we had a network map in the back. You can see a couple of people talking with Brenda, had a lot of comments. And then here's from Get Outdoors Nevada Day. We showed people a buffered bike lane, and they could kind of feel how wide 5 feet really felt when you're on it. So a lot of people liked seeing that. And then we had a large network map in the back where people provided comments. So right now we have online activities. This is the project website, and you can comment on the plan. There are a couple links on that page that'll get you to this network map. And we're asking people to tell us what their top 3 favorite routes are to help us with prioritization, so that feasibility element of public support will be factored in by where the stars are on this map. And then you can also draw lines. If we're missing something near your house that you want to see, you can tell us what we've missed. So then this is the link to comment on the programs, policies, design guidelines. We've provided an abbreviated version of design guidelines so you can see what we mean by a separated bike facility, a buffered bike lane, a neighborhood bikeway, what those terms mean. But we also have the full design guidelines that you can view as well. So the outcomes of this plan, this is technically the bike plan element of the regional transportation plan. So these projects end up being eligible for funding through that. And it's really, at its core, an opportunity for all the local jurisdictions to coordinate. When people are out there on a bike, they don't know that they've just crossed the Henderson line into Clark County, or unincorporated Clark County. So this is an opportunity for all those jurisdictions to coordinate the planning of their facilities. And it provides guidance if local jurisdictions want to apply for federal funding on a project. This would tell them what the expectation is for a recommended bike facility. So with that, we'd be happy to take any questions that you guys have. Yeah.
Yes, you talked about guides to federal funding. What is that about? I understand that educating locals on what's eligible, but what is that person developing?
So the RTP identifies a TIP, a Transportation Improvement Program, that allocates funding, I believe, over a 2-year period. Am I right, Raymond? 4-year period. Okay. So it identifies projects to be funded over 4 years that are part of the plan, and this would be rolled into that. So if there's a roadway project that's included and funded, and the bike plan element says that that roadway should have a separated bike lane, then that should be considered as part of the proposed project.
Because there isn't a designated funding category for specific biking projects.
There is
TAP funds. There's a lot of funds that are eligible for, but there's nothing dedicated to biking funding federally.
Yeah, I mean, there are opportunities for TAP funding as you mentioned. So, any other questions?
Kathy,
Yeah.
are there other entities that are going to adopt this if they are working with us, with the RTC? Are they going to adopt those networks which are like high priority, or the medium priority, or the long-term priorities? As you mentioned, that when the roadway project comes through the RTP into the TIP, and if they're going to improve the middle or overall project, they'll improve the bike lane. So would that be optional, or kind of, would they be like not like, will they be improving that bike lane if there is a bike lane or bike route or whatever that would be?
So it's not mandatory for the local jurisdictions to adopt this plan specifically. The RTC board will adopt it, but we've brought all the local jurisdictions along with us in the planning process. So for the most part, the recommendations in the plan are those that the local jurisdictions support. If there are recommendations in this plan that differ from the local plans, certainly the local jurisdictions can consider in their next update of their bike plans to consider those. And certainly where there are regional routes, we would encourage that. I think for the most part, we're moving along, we're moving forward with local jurisdiction support to the extent that we can.
If I could just add to that too, part of the thought process here is, as we look to performance measures and other best practices in planning in terms of how investments are made, this will help influence and guide where future investments in bicycle pedestrian infrastructure will be made. So, as you know, Farhan, we don't build facilities. It's up to the local jurisdictions to build facilities. But, right now we're developing the regional transportation plan, and one of the driving features is multimodal connectivity. And so the way that this could play in is if there is a request for funding from the RTC, whether it be federal or local, and by local I mean RTC controlled, we can start looking at projects across multiple facets to see what the project accomplishes. So if, for example, there's a Complete Streets project that completes part of the network of the regional bike ped plan, that project would be favorable for funding over a project that doesn't have that element. And that's really what we're trying to work with the local jurisdictions on, is really looking at kind of what the goals and the long-term planning implications are of kind of this network of facilities, whether it be multimodal connectivity, whether it be congestion, whether it be maintenance, whether it be safety. How do we look at multiple things when we evaluate which project should be prioritized?
Kathy, I really like that cross-section you brought out at Outdoors Nevada Day, the buffered bike lane. What was the feedback you received from people there? Did they like it? Did they get it?
Yeah, I think people really, they really liked it. They liked the idea of the buffered separation with traffic, and they liked the width of the lane. So that was definitely something that people preferred over just a standard bike lane. Yes?
Yeah, do you have a data, or if not, an idea of what's the acceptable distance from origin to bus stop and from bus stop to destination? Acceptable distance?
I don't know the answer to that. I know that related to biking, a typical bike trip is around 3 miles. One of the big challenges that we had in this plan is that you can see from that level of comfort map, let's go back to that. Those red routes are the arterials, and most of the arterials have about a mile distance between them. And we tried, for the most part, to stay off the arterials and keep people on bikes on those minor collector roads that had less speed and less volume. But one of the problems is they don't have the connectivity. A lot of the roads end subdivisions and then start again on the other side. So if you're thinking about a person on a bike who's willing to ride about 3 miles for the average trip, to take them a mile out of their way, or even a half mile out of their way and back totals a mile. That's a third of their trip. So this was kind of a challenge in connectivity. I don't know the exact catchment area, but I think people are generally willing to walk at most around 15 minutes to a bus stop. So that's really about a quarter mile on foot. And then by bike, you may be able to get to like a 2 or 2.5 mile distance from a bus stop.
Thank you.
Yeah.
I noticed on the previous slide you have the bike share program, is that what they call it now?
Yes.
Yes, and I think it's a great idea. I've seen the bikes across from the Grand Central Parkway, fairly reasonable, for all day is really reasonable. Maybe it's too early to tell because it just came out. How's that going?
I haven't heard feedback yet on ridership all year long, so I'll be looking for tomorrow. The ranking is sort of in a presentation, and he'll be talking about bike share, and he may be able to share some preliminary results on checkouts. We can check with Ron tomorrow on that. Any other questions? I guess we're finishing a little bit early. Hope that's okay. We'll stick around if you guys want to ask any other questions. Thanks so much.